Hello, beautiful people, and welcome to my channel. Hang on while we connect Instagram so that everyone can enjoy this amazing live that we're about to witness and be a part of. And I think looks like we are live. So hello, beautiful people, and welcome to my channel. If you're new here, my name is Jennifer Diamond, and I'm a certified plant-based nutrition coach, living a whole food, plant exclusive, SOFAs free and gluten-free lifestyle for health and well-being. And I am so excited to welcome a very special guest today, Eileen Kopsaftis. She is amazing and is going to share some wealth of information. Eileen's mission is truly inspiring. She's dedicated to teaching people how to age without decline, live pain-free, and enjoy optimal function for life, all without relying on drugs, surgeries, or invasive procedures. She has a lifelong passion for truth and healing, and her personal journey includes the loss of her brothers, has fueled her drive to help others avoid chronic illness and pain. She's a skilled physical therapist, a certified functional science professional, nutrition educator, and MELT, M-E-L-T, instructor who empowers people to take control of their health through safe, science-based methods. So today we are going to talk with her all about joint pain. So get ready for this eye-opening conversation that could change how you think about aging, health, and pain management. Hi, Eileen. Welcome. How are you?
Hello, Jennifer. I am so excited to be here. It's so funny, you introduced me and I wasn't expecting you to say some of the stuff about my own personal journey, but I remember that's in one of my books. I did share that I had lost both of my brothers in their 40s, one at 42, one at 45, and it didn't have to happen. So it's, I just want to do my best, whatever I can do to prevent that or help other people to prevent that from happening in their own lives. So,
yes. And I'm sorry for your loss, no matter how long ago or how recent. I know loss is always really difficult. And I've been dealing with that myself recently. And so being able to take something like that and make something positive come out of it is a real wonderful thing. And I thank you for all you do. And so, yeah, so, Eileen and I met last year at the National Health Association conference, and I'm so grateful that you wanted to come on and speak to our audience. I just want to tell people that are in the chat or you're watching live, feel free to leave any comments or questions for Eileen. She's going to be doing a wonderful presentation for us. And of course, at the end, as long as she's able, we will try to get any questions or comments answered or addressed, as long as you're okay with that.
Yes, absolutely.
Okay, so I just want to say hello. Sid Nodder is here. She says hello to two of my faves. And then we have Natalie Dixon. Hello, everyone. Marilyn Dubin is saying hello. And everyone else that's watching, we welcome you. And so, yeah, anything else you want to say before you get started with a wonderful presentation that I'm excited to learn?
Yeah, so I do have a lot of slides. I want to warn people that most of them are pictures and they won't be up real long, so we're not going to be here till midnight. But I did want to, when you had asked me different topics and you had mentioned you were getting a lot of people who are concerned about joint pain. It is one of my very favorite topics because there's so much that people don't understand about the potential causes behind joint pain. And so often it's, what we're told, and that age old mindset of, well, you are getting older, or what do you expect at your age? And also there are many people who are doing all of the right things that they know to do. They're eating a clean diet and they're moving consistently and they're exercising, and yet they've got some chronic issue. They've got some joint pain somewhere, and telling them to eat more broccoli isn't going to fix it. So I'm really excited about this, and I'm looking forward to helping as many as I can who hear this. And if anyone has questions after, I will be sharing my email. If you don't get your question answered here, or you're watching it by recording, I do my best to answer whatever someone emails me. And if you don't get an answer within 2 days, please check your spam folder, because that's my nemesis.
Okay, very good. Yes, and you'll be able to share all about your academy and all of your wonderful work that you do. And I think we'll even be able to put up some of that for people to see, so that they can follow you. And we could just quickly put it up now, and we'll put it up at the end as well. You've got to check out Eileen, and if you're not familiar with her, you're going to be glad you tuned in to this. And so, yes, so whenever you're ready, we can.
Okay. I am
Share
ready. Let
screen.
me
Yeah.
share my screen here, and we will get started.
Beautiful.
All right. Okay, so everyone can see this, I hope. And what happened? Yep, there we go. So I titled it Freedom from Joint Pain, which I think this is what you titled it, Freedom from Joint Pain. Everybody wants to be able to move and live and have a quality of life as long as we are above ground and breathing. And so this is my passion, is to help people to do that. I hope and plan to live to at least 112. I used to say to 112. Now I say at least. I don't want to shortchange myself. And, be really stinking happy about it. So many people, when they're older, they're not happy about it because their life lacks quality. So we're going to talk about some of those things that you can use as a strategy, you can apply, or knowledge that may help you to make better decisions. So this is what I decided to do. I want to clear up 5 joint pain misconceptions. And, you can see this here. The quality of our lives depends on the quality of our habits. And that's absolutely true. But we have to know what habits to instill, what habits to develop, and which ones to not or change. And so these are the 5 things I'm going to talk about. We're going to talk about that OA stands for osteoarthritis. Very often arthritis is blamed for your joint pain. And so we're going to start with that one. But first, I do want to share a disclaimer. I don't want anyone to think that I'm diagnosing them or treating them or telling them what to do. This is purely informational. If you have a prescribing practitioner or a healthcare practitioner that you see and you've got any issues going on, you do want to make sure any changes you make based on this information is okay for you, because I don't know what's going on in your world. And the last thing I want is for you to make changes that you need to know maybe a little bit more about something before you do that. Okay. All right. So misconception number 1, arthritis is causing your joint pain. Now, this might seem kind of off the wall to you, but what if arthritis is not the reason for your pain? What if your joint pain is actually caused by something of which you are completely unaware? Now, you can get an x-ray and you can be told, oh, yes, you have arthritis. But I want to share a couple of facts about imaging, about x-rays in particular, and whether or not they're accurate as far as why a person has joint pain. So this was from the Framingham Osteoarthritis Study and Osteoarthritis Initiative, and it was quite large. And overall, this is what they reported. Most patients who had hip pain did not have arthritis show up on the x-ray. And most patients who had arthritis show up on the x-ray did not have frequent hip pain. So this might sound confusing, but what this means is what we're seeing does not necessarily correlate with what the person is experiencing. Although frequent hip pain localized to the groin or the front thigh is very commonly thought to emanate from the fact that someone has arthritis in their hip joint, the x-ray imaging of hips was the arthritis wasn't present in most older people who had hip pain in those areas. And those who showed arthritis on the hip, those who had that pain, got to read this right. Although the x-ray hip arthritis was not present in most older people So just because you've got groin pain and front hip pain, and it hurts when you internally rotate, this is like a classic symptom of hip arthritis. But what they're seeing is that a lot of the times, and this even says most older people who have these symptoms do not have arthritis show up in their hip. So those symptoms of hip arthritis are not predictive of whether or not it's actually there. So a lot of the time somebody will go to their primary care physician and they'll explain their symptoms, and the doctor will say, oh, you've got arthritis. And they might just write a script for an anti-inflammatory, or, oftentimes they will order an x-ray to confirm things. But the x-rays and the experience of pain is not lining up. And it's not just hips. When it comes to our knees, x-rays of knee arthritis, and this is their result of this study, is an imprecise guide to the likelihood that knee pain or disability will be present. So in other words, if x-rays show arthritis in the knee, it doesn't mean they're going to have pain or they're going to have disability. So what the studies are showing is they're telling us the results of these x-rays shouldn't be used in isolation when a person is being assessed. That should not be the end all be all determining treatment, because it could be completely off the mark as to why the person is actually experiencing pain. And then damaged cartilage is not the only cause of joint pain. People who have damaged cartilage do not always have pain and stiffness. And if there's abnormalities in the cartilage found in both people who do have pain and do not have pain. So right now you're probably thinking, what? None of this makes sense, because, if the x-ray shows arthritis, then, that must be the reason for the pain. Not necessarily. Now, we don't want to throw the baby out with the bathwater. If someone has complete severely damaged joint and they have a lot of pain and they sound like a haunted house when they're weight bearing and bending that knee, then more than likely, yes, the pain is from the arthritis, from the damage to the joint. But for the most part, there's this lack of correlation that's being seen, and the data is supporting this over and over and over. So you probably have a question now: how do I find the cause? Well, I want to provide a resource for you, and this is absolutely completely free resource. If you go to this website, havelifelongwellbeing.com, and you click this button, discover how we can help you, you can answer a little very simple 2-minute, 5-minute quiz, 5-question quiz, and it will aim you toward resources and information that will help you to learn more and to be able to do things. So, but I want to tell you, again, we're reinforcing osteoarthritis may not be the cause of your joint pain. And I could go into an entire teaching for days on this, but you are a whole person. Everything is connected to everything else. And so if you have knee pain, it's almost never the knee. I mean, unless that joint is completely severely shot, bone on bone, it's almost never the knee. It's almost always the hip above the knee or the ankle below the knee that's causing the problem. And the knee is just stuck in the middle crying out for help. It's the victim, not the culprit. It's the same thing with your low back. If you have low back pain, more than likely it's the trunk above or the hips below. Everything's connected. I've helped people resolve, a diagnosis of shoulder tendonitis by restoring stability in their ankle. And this was a football quarterback. His shoulder was fine. It wasn't his shoulder. His ankle was so unstable. Whenever he released the ball, the shoulder was going through more range than it was designed to when he threw the ball. When we restored stability to the ankle, he could throw that football 3 hours with a 3-man throw training and no symptoms whatsoever in his shoulder. You're a whole person. Everything's connected. And if you're seen as a body part, if you're seen as a joint that walks through the door, if you're seen as a shoulder that walks in, or a knee that walks in, or a hip that walks in, the person who's helping you is going to be limited in what they can do for you because they're not seeing you as a whole person. So that is critical. Okay. All right. Joint pain misconception number 2. A lot of people believe that diet doesn't impact joint health, and so it doesn't matter what you eat. Now, it's interesting because When I do research on this and I'm looking at what some of the mainstream websites and resources are saying, they contradict themselves. There's the American Arthritis Foundation or Association. I don't even remember what their actual title is. But if you go on there, you'll see some data that shows, oh, it doesn't matter what you eat. Your diet didn't cause your problem. And then when you do a deeper dive, they'll start to say things like, well, food does impact joint health. So it's like they're contradicting themselves. And no wonder people feel like they've got whiplash when they do internet search for things, because there's such a contradiction in what is told. But you might have attempted to change what you eat to lessen your joint pain, or you might believe it doesn't matter what you eat. And a lot of this is confusion. And according to a 2012 study, more than half of Americans that were polled felt doing their taxes is easier than figuring out how to eat healthy. So a lot of people are very confused. And so my biggest passion is to help you to be an informed healthcare consumer so that you can make better choices and have improved outcomes. As Jennifer said earlier, without the meds and the procedures and the surgeries, whenever possible, whenever appropriate, as long as things aren't an emergency or something really serious and you've got to make a snap decision, it's always good to be informed. Ask that number one question: how much will this help me? And what are my risks? It's a very simple question to ask. You need to know your pros and your cons so you can make an informed decision. I can't tell you how many people I saw in a clinic setting who said, I would have never agreed to that med, or I would have never agreed to that procedure or that surgery if I had known my risks, because they're still dealing with the fallout, sometimes years later. So we want to be informed, and you don't have to be a medical expert. You just need to know your pros and cons. People research going on vacation. They get all their pros, all their cons, they get all their ducks in a row. We want to do the same thing when it comes to our own health, our own physical well-being. So, diet and joint damage. I think it's important first for us to define what we're going to talk about. So, the definition of osteoarthritis, there are different forms of arthritis, but this is the most common, is a degenerative joint disease. Degenerative meaning it's going to progress over time. And it even says this, in which the tissues in the joint break down over time. So, let's define the word disease. I always find this interesting because so often we're told that something is normal for our age. What do you expect at your age? That's normal at your age. So if disease is normal, why is it the definition of disease means that it's abnormal functioning? So if we define the word disease, it's an impairment of health or a condition of abnormal functioning. So why do so many people think it's normal? Mainly because it's common. But just because something is common doesn't mean it's normal. Cardiovascular disease is common, but it's not normal. The human body is designed to live really well for a very long period of time, free of disease, free of pain and decline. But that's not what we're seeing. So because we're seeing it as common, we start to believe that it's normal, but it's not. So that's the first mindset that I want you to change. It is not normal. And when we look at joint damage, according to the World Health Organization, these are the most recent stats that I could find. And back in 2019, about 528 million people worldwide had joint damage. And that's up 113% in less than 30 years. So it's progressive. And 73% of them are over the ages of 55 years old. 60% are female, so it skews a little more female than male. Some of that might have to do with the fact that the female has a different body shape, the Q angle, the knee angle, the hip angle is different because of the pelvis for childbearing. But for the most part, it's almost even. And then the most frequent joint that shows damage is the knee, about 365 million people. And then the next most common is the hip. The third most common is the hand. And then over 340 million people are seen to have moderate or severe joint damage. And according to the World Health Organization, they could benefit from rehabilitation. But what does that rehabilitation mean? And we can do a rabbit hole trail looking at what they recommend. But for now, let's see What actually causes joint damage? The University School of Medicine did a study, and this was back in 2011. So we've known this for a while. And what they determined is the primary cause of joint damage. Are you ready? It is not compression and it is not wear and tear. So it has nothing to do with your age. It's chronic inflammation. And here's the resource for those of you who want to look deeper into the study. But it has nothing to do with the fact that, you've been walking around for 60, 70, 80 years. It's not compression. It's not gravity. It's chronic inflammation. And it's important to know this because I love what Dr. Joel Robbins says. The smarter we get, the sicker we become, because we're looking for cures instead of causes. So if it's chronic inflammation, why don't we look at what causes chronic inflammation so we can stop doing that to ourselves? Wouldn't that make sense? So here's one of the causes: diet. Animal protein is highly responsible for chronic inflammation in the body because it contains high amounts of something called arachidonic acid. And that contributes to inflammation. And animal protein is anything with a face or a mother, even if it swims. So many people think, oh, fish is a healthier alternative, or poultry is a healthier alternative, or I'll just have eggs, but no, they all have arachidonic acid, which is something that your body requires, but your body converts the healthier acids from plants into the arachidonic acid that you need. So you're never overloaded with too much of it because you're only going to produce what you need. But let's look at arachidonic acid. According to the USDA standard database, animal proteins produce the highest amounts of AA in the body. Fruits, veggies, grains, legumes, beans, lentils produce little or no because your body's going to convert what it needs from the healthy oils in the plants. And then processed baked goods, they produce a moderate amount. But what arachidonic acid, as I said, it's an essential fatty acid. And it does stimulate the production of pro-inflammatory chemicals in the body when you're overloaded. You convert it as needed from the healthy linoleic acid in the plant oils. But if you're getting too much, your body over-responds during that normal healing and repair process, which we do on a cellular level 24/7. The body is healing and repairing, producing new cells all the time. And what happens when you get too much arachidonic acid is it's kind of like putting a brick on the gas pedal. You're just overloaded with this arachidonic acid and it just promotes this inflammatory process, and it's very difficult to shunt or reverse. So when you get it directly from animal proteins, you're getting an oversupply for the most part. And then excess weight. Fat cells produce inflammatory cytokines. I'll never forget listening to Jack Medina, who was a very well-known coach. He was the head coach in, I'm trying to think of her name now, Kathy Rigby's summer training camp, who was an Olympic athlete, gold medal winner. And he was very fond of saying that, and we're talking decades ago. This is before we knew this. He was fond of saying that when you looked at a fat cell under the microscope, it did nothing. It just laid there and it stared back at you. But when you looked at a muscle cell under the microscope, it was like the 4th of July. There was so much going on. Well, now we know from all of the new information that has been obtained over the years that fat cells are actually little chemical factories and they produce inflammatory cytokines. So they're not your friend. And so what do those inflammatory cytokines do? Well, they're proteins. They're messengers between the cells. And what they do is they bind to a target immune cell to trigger the immune response when something bad is happening in the body, because the immune response is a defense mechanism. But when you have excess, it will lead to inflammation and tissue destruction. And that's what happens when you're carrying excess weight. So that is another promoter of chronic inflammation. And then when we're talking about food, aside from animal foods, these are the things that you want to be focusing on. Cruciferous vegetables. This was a beautiful study, and it looked at the blood markers of over 1,000 women, average age close to 60. And they put them into 5 groups. They're called quintiles in a data study. And it was how much cruciferous vegetables did they eat every day? You know, Brussels sprouts, broccoli, cauliflower, all of these wonderful foods. And so what they found was that the markers for inflammation, tumor necrosis factor or TNF, interleukin 6, were much lower in the women who ate the most cruciferous vegetables. And the amounts that they ate, it wasn't some ridiculous amount. They weren't eating 10 pounds of veggies a day. It was just a cup and a half. The top quintile in that study was just a cup and a half of cruciferous vegetables. I think we all can handle that in one day. The lowest quintile was just a half a cup, I believe. And they did not see the same effect as this. So there's this beautiful, there's no plateau. When it comes to eating wonderful plant foods, there is no plateau. Your body is never going to say, well, we've had enough veggies. You can eat some more, but it's really not going to benefit us. We've kind of, had our fill as far as what the nutrition is going to do for us. That's not true. There's no plateau. The more healthy foods you ingest, the more health you promote in your body. It's a beautiful, beautiful thing. Now, here's another study talking about grains. And I know we're all familiar with those books, Grain Brain, Wheat Belly. A lot of that has been debunked by experts in the whole food plant-based world. But when we look at this particular study, they looked at younger population, not women close to 60, it was, 8 to 15. And they were carrying a lot of excess weight. So I just talked about the fact that excess weight promotes chronic inflammation in the body. So what are you going to do until that weight can achieve a healthy gain? Well, this is a really cool thing. They looked at what happened when they added whole grains to the diet, and they had a control group. And what they saw was those who ate the whole grains decreased chronic inflammatory markers. So, and the group that was not consuming the whole grains, their inflammatory markers continued to increase. So you don't even have to wait to lose weight before you can reduce your chronic inflammation if that's what's going on in your body and you've got pain you can't seem to get a handle on. So that's really good news. And then to follow up on this a little bit, knee arthritis and fiber. There were a couple of studies. Those who ate more fiber, the top 25%, had an over 60% lower chance of getting arthritis of the knee compared to those who ate the least. 60% lower chance. And then the other study, the upper fourth quartile, depends on how many groups you break the study up into, they had an almost 1/3 lower chance of getting arthritis compared to those in the bottom. So what you eat matters for your joint health. Absolutely matters. Here's one. Those who ate the most antioxidants, basically fruits and vegetables, kale, broccoli, Brussels sprouts, lowered their risk for knee OA by 65% when compared to those who ate the least. So we've got study after study after study that tells us how healthy our joints can be based on our diet. And those free radicals, well, this is what happens. Anybody remember this from school? I like to share this slide because a lot of people, they hear the word free radical. They hear it over and over and over. But a picture is worth 1,000 words. So you're going to remember this now. If you remember from science in school, the outer shell is loaded with electrons. And electrons like to travel in pairs. They don't like to be unpaired. Well, an antioxidant, which is only in plants, by the way, the antioxidant has so many electrons in its outer shell, it's generous as all get out. It's kind of like, look, I brought a bunch of friends. You don't have to dance alone. Here, have a partner. And so it gives up all these extra electrons that it has to neutralize the free radical. If you don't have any antioxidants in your body, guess what happens? That free radical roams around your body trying to steal an electron from other cells. And that's how the cells get damaged. So it's a very simple to understand process. And of course, free radicals have been shown to be responsible for aging, degenerative conditions, and disease. And I love this quote. This quote is over 20 years old. And this was published in Time magazine. The news is not that fruits and veggies are good for you. It's that they're so good for you, they could save your life. And Dr. Lester Pachter, I love this quote as well in his book, Dying Young. More than 70% of Americans will die prematurely from diseases caused by or compounded by deficiencies of the antioxidant network. And let me put that into plain English. More than 7 out of 10 people will die before their time by not eating enough fruits and vegetables. So there's so much that we can do, but we have to know what to do. So food and aging well. Now, if you are watching this channel, you probably eat fairly healthy and you love your fruits and veggies. So you see these and you go, man, that looks good. But somebody who's not really used to eating this way is looking at that going, well, it might be a snack, but it doesn't really look like food. And that's why I love this quote by Margaret Mead. It's easier to change a man's religion than to change his diet. Now, I happen to be a person of very strong faith, so I wouldn't see that happening to me. But it's, she's saying this, she did a lot of social studying of the general populations many, many years ago. That's what she was known for. And so this is what I tell people, you can eat really stinking well and be on a whole food plant-based diet. I mean, whole grain pasta with oil-free marinara. This is sweet potato hash. This is lentils. I love lentils. They were like one of my favorite foods. You can literally make gravy that's so healthy. I remember giving a recipe for gravy to friends of mine. They served it at Thanksgiving. They didn't tell anybody that it was a healthy version of gravy. He was a young man in his 40s who had a heart attack and diagnosed with diabetes within a 3-month period. So he was very motivated to get his act together. He had heard me talk many years prior. So he contacted me right away and said, what do I need to do? And he was a very willing student. And so they served that gravy at their Thanksgiving meal with their friends, and their friends raved about the gravy. So you're not missing anything. If you happen to stumble on this channel and you're not already eating this way, trust me, this isn't going out to your backyard and grazing on your grass. This is oil-free roasted red pepper hummus with oven-baked pita chips. You can actually put some cinnamon on these and dip them in unsweetened applesauce. There's so many things you can do. This is Caesar salad made in a very healthy way. That's just tremendously delicious. These are baked falafels with a red pepper aioli. That's a healthy version. Baked zucchini fries. This is one of my favorites. This is fettuccine. And you use cauliflower to make the cream sauce. And cauliflower has one of the highest fat content of plants. It's 11% of its calories come from fats. So it has that nice, rich, creamy mouthfeel. I remember serving, oh my gosh, I always want to say au gratin, but that's not it. It's the other potato. Why can I not think of the name now? And I remember serving that at one of my classes, and there was a mom and a daughter sitting there, and the daughter was like in her 50s and the mom was 70s, maybe 80. And the daughter looked at her mother and said, this tastes like yours. She couldn't believe how creamy and wonderful it tasted. So you're not missing anything except the joint pain, the excess weight, the disease. That's what you're going to miss. And I don't think you're going to want it back. So if you want to age well and live free of disease for lifelong well-being, which is the name of my business, that power is in your hands and your knife and your fork. And I want to offer everybody who watches this recording a free gift. I have an ebook on how food choices impact pain. So if you go to this website, havelifelongwellbeing.com/pain, you can fill this in. If you'd like to get my newsletter, you can check this. But if you don't want anything else in your inbox, my newsletter only goes out once a month. And I do a Friday value video on my YouTube channel once a week. And that's 3 to 5 minute video on pain, musculoskeletal conditions, all kinds of things that can make, benefit your life for knowing. So you can go ahead and do that if you would like to get this ebook. And I forget how many pages. This might be 50, 60 pages. It's not just a little pamphlet. It's got, a lot of information in there. So hopefully that will help you. Okay. So hopefully we cleared up number 2. Diet can impact your joints, and the quality of our lives depends on the quality of our habits. You're going to see that over and over. It's like a little mantra here. Okay. All right. Moving on to misconception number 3. A lot of people believe that arthritis is genetic. So you inherited your joint pain. I'm thinking you've heard this pronounced over and over and over again. My grandmother had arthritis. My mother had arthritis. It's genetic. So now I have arthritis. But what if it's not genetic? What if there's something you can do that keeps you from suffering like your beloved family members suffered? Wouldn't you want to know about it? I'm here to tell you right now that it's actually fiction that you inherited bad genes. Now, yes, you can have some genetic predisposition to specific issues. However, remember the definition of disease is abnormal functioning. So, what if you don't need to inherit joint pain? I plan on having a legacy for my family. My children, my grandchildren, they're going to inherit my home. They're going to inherit my business. They're going to inherit anything that's going to improve the quality of their life. I am not passing down arthritis to my children because they understand the true reasons behind it. So let's look at this. Here's a study that deciphered the osteoarthritis genetics from 9 different populations. Now, I want to caution you because, depending on how much understanding you have about data, I have taken graduate level biostatistics, you might not have. And so when you look at a study, you're completely confused and like a deer in headlights. I'm not going to sit here and read this to you word for word. What I do want to tell you is that what they're doing with this, they're looking at the genetics of arthritis. And you can see here, we provide evidence for genetic correlation with phenotypes related to pain, the main disease symptom, and identify likely causal genes that are linked to the processes. So their results provide insights into key players in the disease processes, and it highlights, I want you to see this, which is why I highlighted this, attractive drug targets to accelerate translation. So I want to caution you, a lot of this research that's going out, and I'm not saying that they're bad people to do this because they're trying to fix people and save people, but what they're doing is they're doing this research because they're looking at a way to market drugs, create medications and drugs to target these things. And you can see here the interest behind this research right here. Funding from GlaxoSmithKline, research funding from Biogen, and all the authors, current employees and or stockholders of Regeneron Pharmaceuticals. So when you look at these studies, okay, what are they looking to prove? And then what do they want to do about what they prove? That's important to understand. Here's a model. It considers that many distinct genetic variants can increase susceptibility to a discontinuous disease or trait, whether a person has OA or doesn't. And then if a person reaches the threshold number of those variants and all the concomitant effects, which is things that are within our control, are exerted, they will consequently develop the disease. So again, mechanism, altering the regulation of the gene expression. So we want an increase or a decrease of what's going on with the genes. Okay? So how can we alter the regulation of that gene expression? With food. But let me share here epigenetics. A lot of us have heard this term. There have been books written about this. We see commercials about it. Epigenetics. It's a big deal. This talks about environmental influences can affect whether and how genes are expressed. I want to repeat that. Environmental influences can affect whether and how genes are expressed, whether they get turned on, whether they get turned off. And early experiences in life can determine how genes are turned on and off, and even whether some are expressed at all. So those ideas that genes are set in stone have literally been disproven. And during development, the human body, the DNA that makes up our genes accumulates these chemical marks that determine how much or little of the gene gets expressed. Now, this doesn't mean that if you had an unhealthy childhood, there's no chance for you. That's not what I'm saying. Don't hear what I'm not saying. But they're learning that environmental influences have a huge impact. And this collection of chemical marks is known as the epigenome. So that's where they got the word epigenetics from. So genetic factors may exert some potent influences. Environmental factors have the ability to alter the genes that you inherited. So you think you inherited bad genes? Diet overpowers genetics because food is information. It contains molecules that literally speak to your genes and turns them on or turns them off. What do we inherit from our family? Recipes, our diet. Now, a lot of us have these warm, fuzzy memories as a child with wonderful family gatherings around the table and our favorite recipes. But many of you, and I'm guessing Jennifer has done this, have probably taken some favorite family recipes and translated them into a healthy recipe that promotes health in the body, does not promote disease in the body or chronic inflammatory processes, and she still enjoys it. I've done that myself. I've taken some of my favorite family recipes and translated them into healthy versions. So I don't miss it. I still smell the smells and I still enjoy the foods, but I also know I'm not harming my body. So what do you want to inherit? So just a last mention on this, diet overpowers genetics. So what are you feeding your genes? These are typical standard American foods, but these are what we want to be eating. Now, this was my favorite summer meal last summer. We had a corn stand open up near our house, and I'd run up to the corn stand and get corn, and then steam cauliflower, beets, spinach salad with toasted garlic, and lemon flavored balsamic vinegar. Oh my gosh, this meal was, I wanted it like 5 days a week. It was so good. And these are baked falafels. I mean, you can eat so well and nourish your body. And I want to tell you, this is one of the reasons that plant foods are so powerful. We still don't know how many phytonutrients are in a serving of plant, but this is just 10 to 15, there are 10 to 15,000 known, probably more we still haven't figured out, phytonutrients in an apple. Now, this lists some of them, but plant food, there is so much power in it and what it can do in your body, because the human body was designed to live a really long time, free of disease, free of decline. 125 to 150 years, some studies have shown that the human heart will last easily if it's provided what it needs to maintain health and it's not given what harms it. So that's good news. Hopefully you're agreeing with me. And Dr. Robbins says the smarter we get, the sicker we become because we're looking for cures instead of causes. Well, I'm sharing some causes now. So I think we've cleared up. Osteoarthritis doesn't have to be inherited. Okay? Okay. Joint pain misconception number 4. Arthritis progression can't be stopped, so you can only manage the pain. Now, when you look at the literature, this is kind of what you'll see everywhere. It is progressive, and you might be able to slow it down, but over time, it's just going to wreak havoc on your body. Well, remember, I want you to be informed so that you can make better choices and have improved outcomes. You are your number one provider. Don't outsource your health to others. Be cognizant of your food and your water intake, your sleep, your movement, your weight, your emotional and your mental health. All of those aspects matter as far as healthy aging. And when it comes to arthritis, these are the common treatments. This is what you're going to get if you go to the doctor because of joint pain. They're going to prescribe a med. They're going to, recommend an injection. They're going to do some imaging. We already found out that imaging isn't really the end all be all accurate representation of what's going on necessarily, and or they might even recommend full-blown surgery. Now, again, I'm not saying none of these things are ever warranted, but I can tell you I have been practicing my profession now for over 30 years, and I can count on one hand the number of times I've told someone that they need surgery. Now, granted, a lot of the people I saw was after surgery. I never got the chance to see them before surgery. They were sent to physical therapy after surgery. I think it's something like 97% of the people who go to a doctor reporting pain only are 93% are not sent to physical therapy. They're prescribed meds or they're sent to some type of pain professional. So, only 7% are sent to PT. Now, again, there's the quality of the PT. A lot of it might be like cattle prodding, and I don't want to get off on a tangent, but it's only as good as the training of the PT that you are seeing. But it's kind of scary that a lot of the times the first advice is just a medication or an injection or, God forbid, surgery. So let's look at a couple of these just a little bit closer, because again, I want you to be informed. So pain medications for osteoarthritis, do they work? Are they safe? Well, let's look at acetaminophen for knee pain. And this, the brand name would be Tylenol. But everybody here, I think, is pretty familiar with the word acetaminophen. It's been thrown around for decades now. So this particular study by the Cochrane organization, it was a review. They looked at 15 studies and over 6,000 participants. And they found that acetaminophen for knee pain or hip pain, it reduced it by only 4 points on a scale of 0 to 100. Now, I want you to notice this. This isn't 0 to 10. Now, the pain scale, 0, no pain at all. 10, the kind of pain that you're laying on the floor screaming and begging to go to the hospital. That's a whole different thing. This is 0 to 100. So this means if your pain was like maybe a 50, well, now it's a 46 out of 100. How would you even notice? I kind of question how they even noticed it was different. And then the physical function and stiffness were considered about the same between the med and the placebo. So now I know you might be someone, you take it, it does help you with your joint pain. Well, I'm familiar with someone when we get to the ibuprofen, who was taking pain medication. She had changed her diet. She had altered her food intake and had been eating pretty clean for quite a while. But she had some severe issues going on. So she kept taking the pain med until it messed up her stomach. Then she stopped taking it, and she was expecting to feel the pain because she stopped taking it and she didn't have any pain. She didn't realize she could have stopped taking it a long time ago because of her diet changes. The pain had stopped. So sometimes, it's this kind of stuff can actually be useless, but we think it's working. And then why does it matter? Toxicity levels. There's a lot of risk with self-medicating because acetaminophen is currently in over 600 medications, both over the counter and prescription. And it's known to be the causative factor behind acute liver failure, liver transplant, and even death. And here's some studies in this 10-year period. The acetaminophen-related deaths were 2 times those of all other over-the-counter pain relievers combined. And then over half of the cases of acute liver failure here in this 5-year period were due to acetaminophen toxicity. And I can tell you right now, my own dad, he passed at the age of 93. He did have chronic lymphocytic leukemia, which was at bay when he was doing the right things nutritionally. And when he stopped, the symptoms of that started to bite him. But his last couple of months of life, his caregivers were giving him acetaminophen just to keep him comfortable. Nobody was overdosing him. It was well within the parameters of what you can consume in a day. But because he was in his 90s, he was on other medications and he was battling some chronic disease processes. The acetaminophen was kind of the tipping point. It was too much for his liver, and he literally became very jaundiced the last few days of his life. He was pretty yellow because it was too much for his liver. So the reason I share this is if you have an older family member and they have medical issues and they're taking medications and they're taking acetaminophen consistently around the clock, that could be the tipping point that overtaxes their liver because it's just too much for them to metabolize. So I always want to put this out there for people because a lot of people aren't aware of this at all. And then non-steroidal anti-inflammatory drugs, mainly ibuprofen, Advil, I mean, I could name a whole bunch of names here, but this was published in the British Medical Journal. There were 23 studies that included almost 11,000 subjects, and they were looking, was NSAID effective? Efficacy means did it work for knee pain? They looked at 23 trials, and out of those 23 trials, 16 of them were sponsored by pharmaceutical industry, and 3 others, they showed an address of working at a pharmaceutical company. So that means out of the 23 trials, only 4 of them had a potential lower risk of bias. Now, this doesn't mean that 19 of them were lying through their teeth, but there is something in clinical studies that are published. They do talk about there is a higher risk of bias depending on who's funding the study. Doesn't always mean that's true, but it can be. Okay. Now, here's the part that got me. 13 of the studies excluded participants from the study if they didn't respond to NSAIDs. Now, I'm hoping right now you're sitting there going, what? Talk about stacking the deck in their favor. Oh, if you don't respond to an NSAID, we don't even want you to join our study. Now, a lot of people are completely unaware of this when it comes to clinical studies, but they can cherry pick their subjects. They can choose subjects or refuse subjects based on certain parameters. And it's completely above board. Nobody's doing anything wrong. So think about it. So they cherry picked the subjects. There was a lot of bias in the studies, and the overall difference short term, the NSAIDs only improved pain by 15.6%, better than placebo. Now, 15% might take the edge off. Say you've got a pain that's like a 7 out of 10. That's pretty severe, and it's really not very pleasant. So you take this medication, and now your pain is like maybe a little over a 5 out of 10. It could take the edge off and give you a little more quality of life. So, but now you're making an informed decision. But I will tell you that this was short term, just 2 to 13 weeks. Only one trial looked at the long-term effect, 1 to 4 years, and they found no significant effect compared with placebo. So the conclusion of the study was that NSAIDs can reduce short-term pain slightly better than placebo if you have arthritis in the knee. But the current analysis doesn't support long-term use, and that's because of serious adverse effects associated with taking these meds. And as I said, I had a family member who literally trashed the health of her gut lining because of taking these NSAIDs, and it took her a while to heal that. So, NSAID use, it's linked to over 16,000 annual GI bleeding-related deaths, an increased risk of serious cardiac issues like atrial fibrillation. Now, this is just one study. When you do a deep dive into this, there are, oh my gosh, I think there was over 40,000 studies that you could look at that looked at the risks of NSAIDs. So it goes to show there must be a lot of risks, because why would people keep studying something? It's because stuff's there. And then, here we go, 22,000 studies. If you look at NSAID risks, sorry, I should have looked at my own slide. I was trying to remember from my brain. And then long-term use is associated with all kinds of problems, irritating your stomach. You get ulcers, heartburn, diarrhea, fluid retention, kidney dysfunction. And yes, cardiovascular disease is seen as a risk with long-term use of NSAIDs. I don't think anybody wants to harm their heart by addressing joint pain. And then a lot of people are completely unaware of this fact, but NSAIDs are seen to inhibit muscle growth. So if you're getting older and you want to make sure that you are training and your muscles have all, you're putting all your ducks in a row so you can get those muscles stronger and bigger. Now, this study was on young individuals, so it wasn't even older people. So who's to say this wouldn't happen in an older population? It would seem like that's a pretty highly likely. But young individuals using resistance training to maximize muscle growth or strength should avoid excessive intake of anti-inflammatory drugs. And when you looked at the study, they weren't doing excessive intake. They weren't going above the label on the bottle that says not exceed this amount. But inhibiting muscle growth, this particular study looked at training the quads, the front thigh muscle. But if it inhibits muscle growth here, I would think it would inhibit muscle growth pretty much anywhere in the body. That kind of seems logical. I mean, I don't think I'm extrapolating too much from this study. It just seems logical. All right, steroid injections. Do they work? And are they safe? Well, let's look. Patients who had symptoms and arthritis in the knee were given 2 years of steroid injection compared with 2 years of saltwater injection. Now, saltwater isn't going to change anything. It's very inert. So that would be considered the placebo. It resulted in significantly, this was the steroid injections, resulted in significantly greater cartilage volume loss and no significant difference in knee pain. So the result of the study, this is their writing, not mine. These findings do not support this treatment for patients who have symptoms with knee arthritis. And it's interesting because I did a deep dive on this a few years ago when I spoke at a conference. And what I found was when people go to see experts when it comes to joint pain and when it, to get injections and to have these things, there was a surgical guidelines, and the surgical guidelines at that time were saying not to do injections in the knee for OA. But yet people go and they're offered an injection. Now, I've recently updated my knowledge of the current surgical guidelines for the orthopedists, and they're now recommending that it can be done based on the data. But when I looked at the data, it was kind of, as my younger daughter likes to say, meh. Wasn't impressed. So, and then when we look at the hip, such injections may actually be deleterious and may spur osteonecrosis. Osteo is bone, necrosis is death. So death of the bone and bone collapse. Do we really want that risk? This study broke people up into 3 groups. They did a group that got the shot for the hip OA. They did the group that did not get the shot, but they did have OA in the hip. And then they had a group that got a shot in the shoulder. And you might be like, why are they doing that? Well, they wanted to be sure that it wasn't just because of a systemic change. So these people didn't have OA in the hip, but they did get steroid injections in the shoulder to see if it made a change in their body because of systemic changes. So here was the reports from the radiologists. Those who got the shot in the hip, 22 to 24% of them showed new bone death. Only 9% showed that in the control group that didn't get a shot at all, and only 5% in the control group that got the shot in the shoulder. So I would say this isn't a very good outcome at all. They also found bone collapse at the head of the femur, which is the top of your thigh bone, goes right into your joint. 15 to 17% of them had bone collapse who got the shot in the hip, only 4% in those who didn't get the shot, and 2% in those that were the shoulder control group. So this is what they reported. Rapid changes in bone are seen in the group that got the shot in the hip. And this is what they're sharing. This is their words, not mine. Changes due to osteoarthritis, such as narrowing in the space between the joints and the developments of bony proliferations, those little bony things that happen, which is your body trying to make an unstable joint more stable, by the way, typically develops slowly over time. But when they found, looking at these x-rays, those who had gotten the hip injection, changes had developed rapidly. So it's kind of progressing what we want to stop or reverse if possible. And of course, there's a lot of side effects. Corticosteroid injections are common in the shoulders and the elbows and the knees and the hips and the SI joints and the spine. And I do a lot of teaching on this, and I could go on and on about this, but there are side effects. So ask that question when you are in the orthopedist's office and he says, well, let's do an injection. Okay, what are my benefits from this injection and what are my risks? You need to know. We had an orthopedist lecture over 25 years ago in a clinic, that was in a hospital setting. And this was over 25 years ago. And he's one of the best orthopedic surgeons in the area. If ever I was going to need orthopedic surgery or recommend it to a loved one, I would want them to go see him. The guy is phenomenally gifted. Remember, we see the outcome of people after surgery. So we know who's good and who's not good. We know who not to go to and we know who to go to. And this guy was the best. And he said, you never inject the same area more than once because it will damage the tendon and the cartilage. So he knew this. He told us this over 25 years ago. So we need to know this. And I can tell you a couple of very positive things. Bromelain. Bromelain is seen to be effective for pain relief for conditions like arthritis, moderate to severe rheumatoid arthritis. They compared this to an NSAID, and the bromelain was found to be effective and safe alternative. Reductions in joint pain and swelling, improvement in range of motion, improvement in function, and pain at rest. And usually it's coming from the top of the pineapple, which makes it very inexpensive to purchase. And it's a great thing. It's basically, it's from pineapple. Now, there are some things that you need to know. You do want to take it on an empty stomach, because if you take it with food, it's an enzyme, and it is used as an enzyme to help digest the food, but then it won't necessarily do its job as an anti-inflammatory. So, but the mechanism of action, it's thought to be like the effect of the bromelain on the pain mediators. There's some very specific ones, and I don't want your eyes to glaze over and give you too much detail, but just know that bromelain, you can get that in any health food store, and and it's very simple and easy to take. But you do want to get some advice and make sure you're doing things correctly, okay? And it's safe. And then there's a bioflavonoid called nobiletin, and this was isolated from orange peel back in the 1930s. It's a very powerful anti-inflammatory agent, and it significantly inhibits two of the powerful free radicals that promote inflammation. Now, it can help to protect against a host of age-related problems, including joint discomfort, cardiovascular problems, and other inflammation-induced disorders. Foods that are high in nobiletin are tangerines and oranges. So I want to emphasize that a pill containing nobiletin will never really give the same protective effect of the food that contains it. Now, of course, all plant foods are very high in antioxidants and are beneficial for joint health, but I wanted to give you a little extra oomph if you wanted to try this, adding some oranges or tangerines to your diet if you've got joint pain. And exercise. Exercise is very important. This was a study that looked at strength training versus range of motion. Strength training wins out every time. Strength training will beat range of motion. If all you're doing is just moving your joints, non-weight bearing, sure, it might keep them from stiffening up, but you really need to be doing strength training. Those who did that maintained more strength. They had less narrowing of the knee joint space. But of course, you need to do it correctly. You don't want to be, as I call it, punching the bear in the nose. Okay? You don't want every repetition to be screaming at you. You have to know how to train. That's where seeking expert help can be very beneficial if you have pain with movement. And how to avoid a knee replacement? According to the Radiological Society of North America, muscle strength in the leg is a major factor in determining if a knee replacement will be needed. You want strong quads, you want strong hamstrings. They have a counterforce, and they will protect the knee joint. Now, your hamstrings do come down below the knee, and they're kind of like reins on a horse. They control your knee rotation when you're walking. They help to extend the knee when you're walking. I'm not talking doing those weird exercises in the gym where you stand against resistance and you push your foot up into your butt, to strengthen your hamstring. That's very inauthentic. You want to do more authentic things like squats, lunges, those kind of things. That's really going to strengthen your quads and your hamstrings in a way that the body's designed to use them. And you can see strengthening these muscles can prevent progression of arthritis and the need for knee replacement in over 50% of the patients. And here's a knee replacement surgery study. 100 older patients who were eligible to have a total knee replacement, that's what a TKR is, over a 2-year period, everybody improved, including those who only were given non-surgical interventions, which included exercise, diet, and of course, we know the pain meds don't really do much. But surgical patients fared better initially, but had 4 times as many complications, infections, blood clots, knee stiffness. I mean, I'm not trying to scare anybody here, but the new class of blood thinners is absolutely scary. In the younger population, 60s or so, they're seeing a lot of clots in the lungs. In the older populations, like 80s or so, they're seeing brain bleeds from these new class of blood thinners. They are, we were better off with Coumadin. Yes, you had to get your blood levels checked regularly to make sure you had the right levels of Coumadin, but it wasn't killing people off. Some of these new class of blood thinners are really dangerous. So it's happening. So the surgical patients fared much better initially, but they had 4 times as many complications, severe enough. And if it was severe enough, another surgery was required. The complications more common and more serious than you may realize. And I've worked with patient population, like I said, for over 30 years. 1 in every 100 to 200 patients who has a total knee replacement dies within 3 months of the procedure. Now, I'm not saying specifically that surgery is what killed them off, but we do have the risks of clotting, infections. I've known some people who had such serious reactions to a total joint replacement that after 2 or 3 surgical revisions, they removed the prosthetic joint and the person literally went the rest of their life without the joint in their leg because there were so many medical issues going on. They just couldn't fix it. And as many as a third who have the surgery continue to have pain. So, cartilage. Let's talk about what we can do. Cartilage and inactivity is one of the biggest contributors to cartilage destruction is inactivity. It's inactivity that kills. Lack of exercise alone is the 4th leading cause of early death worldwide. Not exercising, believe it or not, after blood pressure and a couple of other things. So, can your cartilage regenerate? The myth that cartilage can't be repaired or regenerated is still promoted and widely believed. Mature cartilage contains both a progenitor and a stem cell, which indicates that it has the capacity to repair. The mechanism for the regeneration, it's kind of like the way in which animals like salamanders, zebrafish, hydra can regrow body parts after the loss of limbs or other appendages. It's a very cool process our body can do. But we have to not inhibit it. We have to get out of the way of the body doing what it knows how to do. And we need to promote it. We need to be doing the things the body needs in order for that capacity to occur. So here was a study. It looked at 86 healthy subjects and 19 locations. At least half the cartilage tissue was worn away. At a 2-year follow-up, what they found was improvement in more than half of them. Slightly less than a third were worse. The remainder were the same. And those with the worst cartilage destruction were the most likely to show improvement because of how the body has that capacity. So patients with previous knee surgery, many who continue to have pain, stiffness, functional limitations, they were randomized. They either were in an exercise group or a control group. And the exercise group, improvement in cartilage. Now it was dose dependent. The more exercise, the more improvement. This was the first human study to confirm animal studies showing that cartilage can improve. Reduction in stiffness. And it was related to the degree of joint loading. So you kind of really have to know what you're doing to do this correctly. But those who exercise more had increases in something called GAG. Those who have joint disease show a decrease in GAG in the cartilage. And the pain severity they experience is related to how much GAG they have. So we want to increase that. And people who exercise more will increase that. And walking in knee OA, your patterns of walking and your body mass index, they impact the cartilage, how it responds to the loading. So you want to have a healthy gait and you want to have a healthy weight. And I have to mention here, because a lot of people think nightshades are this really risky thing for arthritis. And, they include white potatoes, tomatoes, tomatillos, eggplants, bell peppers, goji berries, and tobacco, which hopefully none of you are smoking. But nightshade vegetables are the edible parts of flowering plants. And the nightshade family includes over 2,000 plants, most of which aren't eaten as food, some of which, such as belladonna, are poisonous. So, these are the ones we're the most familiar with, but these are some other nightshades, herbs and spices. You've got cayenne pepper, crushed red pepper, chili powder, paprika, and then there's condiments from nightshades. Nightshades are used to make them: hot sauce, ketchup, tomato-based sauces, and salsa. So here's the interesting thing. Now, some of you may notice if you consume nightshades, you have joint pain, and if you don't, you don't. But I do want to tell you there are no studies that definitively show consuming nightshade vegetables causes inflammation or disease. And if you do an internet search, you're going to see mostly newspaper stories and surveys of self-reported data that's been analyzed by the doctors. That's really not science. Now, you can use an elimination diet. Results can be highly variable. Some people find there aren't any foods to which they're sensitive. Others determine that foods that are not usually on the highly suspect list, like bananas and black pepper, cause problems. But in the case of nightshades, few members have discovered a sensitivity to them. And those who have discovered sensitivity have identified one food, not the whole category of nightshades. And elimination diets are really difficult and time consuming. So it's really best to just adopt a health promoting diet, which is what Jennifer is teaching on this channel. And hopefully you are learning and following. Okay. So we're almost done. Being an informed healthcare consumer means making better choices with improved outcomes. So we've just cleared up, I hope, joint damage doesn't have to progress. You can halt it. You can even reverse it by doing the right things. Misconception number 5. Joint pain is a normal part of aging, so it can't be avoided. Well, it's interesting because, arthritis, cartilage degeneration, oxidative stress, is it due to aging? Well, not really. So, I could go into some depth and detail about this particular study here, the role of aging in the development of OA, but I think your eyes would kind of glaze over. There's specific cell signaling pathways and altered redox signaling and novel targets and all kinds of stuff. But I want to just give you the bottom line. Even the World Health Organization says that osteoarthritis is not an inevitable consequence of aging. And remember, common doesn't mean normal. So hopefully you now know joint pain is not a normal part of aging. So the solutions that are offered by conventional medicine, what's missing? The core issue is not addressed. We forgot about the whole person. As I said earlier, I've seen many who say, I wish I knew then what I know now. I would never have agreed to that. And I remember taking a manual therapy course by an expert PT from New Zealand. It was a Mulligan's Mobilization with Movement course, I believe. And she said, here in the US, you guys are, surgery kind of happens pretty often. She says, in our country, it's less. But she said, I want you to lay across your patient and say, no, doctor, let me have them first. Of course, I tend to see people after surgery. Nobody sent them to me prior. So it's kind of hard to stop something once it's already happened. But you must address the cause of the problem versus treating the symptoms. You don't take a body part off and put it on a shelf when you go to bed. Everything is connected to everything else. So the best strategy, you and whoever you work with, your PT, your personal trainer, your surgeon, your doctor, your massage therapist, whoever you work with, must understand how your body performs and reacts through motion and functional living. Because nobody wants to end up in a nursing home by default because they decline, they weaken, they end up with pain, and they lose their independence. So imagine if you had this kind of pain-free motion in your body, what would your life look like? So hopefully you're not feeling like a deer in headlights right now. If you are, I want to invite you to a free event that I'm hosting It's starting July 7th. It's just 3 days, just 1 hour a day. I'm calling it the Aging Reset so that we can reclaim what aging has stolen from us. And this is the website right here, havelifelongwellbeing.com/aging. And I really hope to see many of you there. If you're watching this by recording after the fact, there were those other couple of things that I offered earlier in this presentation, and hopefully it benefited you. So I will stop sharing and see if I put everyone to sleep or not. Are you still awake there, Jennifer?
This was so informative and so wonderful. I kept going, jaw dropping, and I was like agreeing, and I was getting excited. And thank you so much. Yes, I really think that everything you shared and the way you shared it, I loved the way you explained everything and broke it down, is really going to help a lot of people.
Right.
And yes, so thank you so much. Oh my goodness. Core Scorpio says, thank you for the wonderful experience, Jennifer, and thank you, Eileen, for such an impactful, well-organized, in-depth presentation for us. This was fantastic. Thank you both so much. And thank you for watching. And, you know, we did have some comments and some questions. If you are still okay, we can go through those.
Sure. Yep.
And you know what? I will just say, definitely take up Eileen on the free 3-day workshop. You will only gain from it. I have done them before, and they're amazing. And it's she teaches in a way that I've never seen or heard of before, and it's just amazing. So if you can,
yes.
I recommend it. And I think, is it not true that if somebody signs up for it, isn't there a window of time where it can be a replay if they can't join the live? Or is
yes,
that?
I do record, and if they can't be there live, it is available for a limited time after, so they can catch up, see what they missed, and whatever. And I did want to mention, just in case, for anybody watching this live or seeing this in time, I will be teaching movement at the National Health Association conference in Ohio the end of June. So if anybody wants to work with me live in a room, you know, come to the conference. There's a lot of great people there, a lot of great speakers, and the food is amazing. So I stuff myself like a Thanksgiving turkey at that conference, and I lose paint. I lose like 2 pounds. I don't know how that happens. It must be that I'm not as good at home.
Oh, no, it's amazing. And I did recently share about the NHA conference, and it's not too late to purchase a ticket. And then if you aren't already going and you're still thinking about it, and of course, that's amazing to know that people could work with you there in the mornings and, you know, during the conference, whenever that's planned. So yes, definitely. So let me just go back here. Whoops, hold on. Let me just see what we have here. A lot of people came in later, lots of hellos, and a few comments. So LaShawn Weaver Lee says, I reversed lupus with a raw diet over a year ago. I can't get rid of the pesky aching in my fingers. I am still on the raw diet. I put huge pieces of ginger and turmeric in my smoothies daily. And then she continues on, I also take turmeric supplements daily. What am I missing?
So, you know, I really can't give anybody specific advice because I don't know a thorough history and I could cause harm. But what I can say what might be helpful, there's something called the MELT method. I teach a monthly class on that. The MELT method has a very specific way of doing a hand treatment. And what that might do is that might decompress the joints in the hand, get the fluid moving. The lymph just might be getting kind of stuck in there, and you're going to hydrate and decompress those tissues. You might find that that's very, very helpful. It's very gentle. It's a very specific way to treat the lymphatic system and the neurofascial system in the body. So you might find that really beneficial.
I love that. Thank you so much. And we just also put Eileen's social media, you know, different references so you can follow her. And then we also, let's see what else we have here. I'm trying to go back. It scrolled away from me. Yeah, and LaShawn is asking about some other things that are more detailed. I'll read it, but I'm not sure that you can help. She says, I am on, if I can pronounce this right, Benalsta, Benlysta, and and methotrexate, and was tapering, but reluctantly increased it again on advice of my rheumatologist. Some of my aching has improved. I really want off these medicines. And a hand surgeon just told me this yesterday as my x-ray showed some arthritis in the DIP joints of my
the
fingers.
distal interphalangeal joints. Yeah. So again, as you heard, the imaging, just because there's some arthritis in there doesn't necessarily mean that's what's causing the pain. It might have nothing to do with it. It might. It's hard to tell. Really, I'm just thinking the best that I can recommend is trying the melt method for your hands, because just go to meltmethod.com, get the foot and hand kit. It's I don't have one up here. I just taught my monthly class and it's downstairs. But it can be so beneficial. It actually helps to improve your body into the parasympathetic nervous system mode, which is the healing and repair mode, and gets you out of the sympathetic, which is the run from the bear mode, where all the chemicals get released that cause a lot of havoc in our body. So it just has so many benefits, especially based on what you've shared with your own health journey. I think that you would love it. It's wonderful.
I love that. Thank you. Core Scorpy says, love the science and facts with the presentation. Todd says, Eileen's a rock star. And we have some more people. Vegan Knowledge JJ came in. And she said, in 30 days of the raw vegan diet, I eliminated chronic back pain. It's a miracle. And that she had terrible pain for 18 years. So this is amazing.
Yes. And, I can speak to that for just a moment. When there's Dr. Lena Kopila, when I went to a PCRM conference back in 2015, I believe it was, she was presenting a talk on low back pain and cardiovascular disease. And I was like, oh my gosh, seriously? What's that got to do? I had to go. Well, it was like this God incident. I ended up sitting right behind her at the conference, and there's thousands of people at this conference. And she did her talk, and I was able to talk with her after she presented, because I didn't know what she looked like. But she's been doing research for decades. She's prolifically published studies on back pain and cardiovascular disease. And what she found is the lumbar arteries that feed the blood supply to the lumbar spine get occluded. They get impaired. Most of us are worried about having a heart attack or a stroke. We don't want to block the blood to our heart or our brain, but the blood to the spine is getting blocked. And she's done so good in her research that depending on which branch of the lumbar artery is blocked, it will lead to specific symptoms, like degenerative disc disease, or having deep hip pain with exercise. And I can tell you, in all the years I've done this, that when I came across that information, and I did a lot of study in her studies, and it was powerful, very informative. And then when I would work with somebody, and no matter what we did, we couldn't stop the back pain, and I knew they had an unhealthy diet, I would tell them, there's nothing you're going to be able to do until you change your diet. Nothing. And that's probably what that person experienced. There was probably some lumbar artery occlusion, blockage, and the healthy diet helped to open up the arteries, which we know it can. Dr. Caldwell Esselstyn does that work. And that's what happened. So yeah, good for you.
Yeah. And I love how you spoke about inflammation and, how food is really healing or not. And it's just such a big part of creating who we are. So, yeah. And then we had a few people talking. Mona says, I eat a lot of pineapple. And I grabbed my pineapple and brought it right over.
Yes. One of my favorite combinations is pineapple and pink grapefruit.
Oh, really? We got one of those right here as well. So I'll have to remember to try that.
Yes, I do it as a smoothie, and it's amazing. So.
So the bromelain you spoke about, you said it's at the top, but I always thought it was
Well,
the
it's throughout the fruit. It's just that if you buy it as a supplement because you're trying to do like post-surgical inflammatory, or you've got some condition that you're trying to reverse and you're changing your diet and you want to try to stop the inflammation a little bit quicker, you'll buy the supplement. And when they make the supplement, the reason it's so cheap is because they get it out of the stem that nobody's eating typically. Now I know a couple, they have a whole ton of Juice Plus Tower Gardens, and they said that they put a piece of the stem in their smoothie in the Vitamix, and it will get it up there. Yeah. So,
wow.
but it is obviously in the fruit as well.
Yeah, and I eat the core, which is kind of very fibrous, but I always thought that that's where the bromelain was. Now you just taught me that it's throughout, so that's great.
Yes.
And one more pineapple thing here. We said, LaShawn Weaver Lee says, I eat pineapple every day, including the core where most of the bromelain is, which we just said, oh, how much supplements do you recommend? And I'm sure it's going to have to be a general answer if you have one.
Yes. Well, generally speaking, the data says, some of the studies, it was like 1,500 milligram. Typically, when you purchase it, it's either a capsule or a tablet, and it's a 500 milligram per capsule or tablet. And the data shows that you can take, depending on your body size and type, up to 2,500 milligrams per day. So that would mean no more than 5 per day, but that's going to depend on you and your body size. And, so that's just a general report. You would have to maybe talk with somebody and make sure that you're doing things right for you.
Very cool. Very cool. So I have a question.
Uh-huh.
Why does it seem like when we wake up, and I say we, I think people in general find that in the morning, that's when we're the most achy or stiff. And is there a cause for that? Is that like everybody does that, or,
It's interesting that you say that, because, when you're a kid, you're not, right? So, and sometimes you'll stretch, you just get that stretch. It's not so much that you're stiff, you're just kind of stretching. I can admit that doesn't happen to me in the morning. So, but I do 3-plane movement and training consistently. It's kind of like by default because I'm working with people and I'm teaching classes, and I also melt regularly. So I don't really have that morning stiffness, but there is an expert that you can watch. His name is Gil Hedley, Gil. His last name is Hedley, Hedley. He's prolific on YouTube. He's got his own website. He's a real expert on neurofascial. And he has what's become famous in my world anyway, the geeks like me. He's become famous on his fuzz speech. And he describes it as fuzz. And he has like a 5-minute video he explains kind of where that comes from. So
thank you. We put that in the chat, the name, if anybody needs to look at that, it is in the chat. And thank you for that. And just a couple more questions. So, and I don't know if you could answer this, or maybe you have a program that would help, but is there a best way, or what is the best way for someone to warm up the joints before a workout?
Yes. Well, my favorite is 3-plane training, which I know you shared that you do in the mornings because you've attended some of my stuff. So when I say 3-plane training, as a human being, we move in 3 planes of motion. We don't just, if you see somebody do the robot dance, it's because they're moving in 1 plane of motion, so they look like a robot. Well, we don't look like a robot when we move because we're moving in 3 planes. So we move forward and back, and we move sideways, and we rotate. Well, a lot of the times when people exercise or they warm up their body, they're only moving in 1 plane of motion. So you want to do 3. And so I have a free membership level in my Move Without Pain private club. So, and I didn't give you this link, but if you go to mwprivateclub.com, you will see there's a free level membership. And I call it my MPA, or a movement performance assessment. And people can assess their own movement in 3 planes and figure out where the culprits are. So if you have maybe right knee pain and you think it's your knee, well, it's probably not. And you're going to do this 3-plane assessment and you're going to go, oh man, my left ankle isn't doing what it's supposed to do, or my right hip isn't rotating right. And you're going to figure out that's the culprit. And then you know where to train your body to focus your energy on to help your knee. So if they go there, that MPA is there. It's absolutely free. There's also a free workout where I teach people how to move in 3 planes with exercise. So
Yes, that's
they can get
great.
it.
That's great. I appreciate that so much. And I just want to say, Sid Notter says, great presentation as usual with a heart. So I'm so glad that
Thank
you
you,
enjoyed that.
Sid. Thank you.
And
Yeah.
you had a picture on your presentation of you in all of these different snapshots, different
Yes.
movements, and that's kind of what you're talking about.
Correct. Yes. Yes. I can walk somebody through in about 20 minutes. I can walk somebody through 6 movements, right side of the body, left side of the body. So it's 12 motions. And I can discern where the big rocks of the body aren't playing nice with each other and give them advice on how to move to train those body parts. And a lot of the times, I mean, I've seen people's pain resolve sometimes in like 1 session. Not always, depends on how chronic it is and how long they've had it and all the layers, the onion layers that are going on there. But yeah, training this way, most people, I work with a lot of people who go to the gym regularly. And unfortunately, a lot of the things that we do in the gym aren't the best way to train the body. And it causes tendonitis, tendinosis, tendinopathy, because we're isolating and we're doing things we would never do in real life, like isolating the tricep muscle like this. But, when you go to use your triceps, you're going to kind of squat down a little and you're going to push through your feet. So you're going to be using your power muscles, gluteus maximus there. Max is going to be part of that. And to push something up overhead. So, when we're in the gym and we're doing repetitive motions against resistance and it's not an authentic movement, we're really more at risk of causing problems than helping. So it's good for people to understand what 3-plane motion is and how to, do things right in a way that's beneficial.
Yes, and you are the leader as far as I'm concerned, and such a wonderful teacher. So, if anybody is not really sure about this or is interested, you have got to reach out to Eileen for sure. One more question is, I don't know, so the difference between a static and a ballistic stretching, is there a right or wrong way or wrong time? Is there anything that you could say about those types of stretching, meaning some that are just where you hold it versus where you're moving, like what you have been
Yes.
teaching?
Yes. Yeah. So I'm not a big lover of stretching, like old fashioned understanding of stretching. There's a website where this guy does a phenomenal job where he's researched the last 200 years of data on stretching. And there's 9 muscles in your body that you can't even stretch because they don't lengthen enough. That's not how your joints work. And a lot of the muscles that we stretch are kind of those muscles. So it's interesting. But what I do is I teach people how to load and unload. And load means the muscles getting longer under tension, and then it's unloading back to a shortened position. So that's kind of how your body's designed to move. When you start moving, your muscle's job is to respond to the movement and control the movement. And it controls it mostly by getting longer under tension and then shortening. So you really want, there's the ballistic stretching, like you said, it could also be called dynamic stretching. So there's static, which means you get longer and you just hold it, which is very inauthentic, which you're never going to do in real life. When you take a walk, you're not going to take a step and wait 30 seconds before you take another step. So what you want to do is you want to load and unload the muscles repetitively. And it creates this beautiful kind of a fluid fill effect, this pumping action. It's just a beautiful way to train the body. And it's also been seen, it's like an eccentric load because it's getting longer. It's also been seen to be the best strategy for healing tendon issues. So,
Wow.
yeah.
That's amazing. Okay, well, we just learned some more. You're just such a wealth of information. If anybody else has any last questions, go ahead and put them in the chat. Otherwise, I just want to thank you so very much for your time and all your expertise. The presentation was amazing. I can say I certainly learned a lot, and going off the comments, I think people really, really enjoyed it. So
Yes.
thank you. And
Thank
I
you.
invite you to come back anytime you want to talk about any other
Yeah.
types of, body parts and
Mhm.
different things. And
I would love that. Yes, anytime.
all right. Well, for all of you, thank you so much for hanging out with us. And don't forget to eat your greens. You know, I always say that. And of course, don't forget to give plants a chance. Take care.